I have the pleasure to give the floor to one of our sponsor, the CEO of DrugCards, Dmitry Horilyk. I hope I pronounce it correctly. Yeah. And you know, from one crisis to another. So we are moving from the pandemic to the other crisis that shut a little bit our lives, and especially the Europe territory. Dmitry can say a few words about himself and about his company in waiting for the presentation. Thank you, Dmitry.
Hi, everyone. My name is Dmytro, Horilyk, my surname. No worries about that. I know what you may think. I'm the chief executive officer of the drug card company, and you may think that guy is really young for that position. But I'm really young. I'm only 28 years old, and at this moment I have about 10 years experience in the pharmaceutical industry. Because I started to work from 18 as a process engineer in one of the Ukrainian manufacturers, pharmaceutical manufacturers. Then I moved to the QA department, quality assurance, and I was responsible for preparing the national pharma manufacturers for global inspections like WHO, FDA, and so on. The one, okay. So we already get to continue. So as you remember, the good pharmacovigilance practice mentioned about 12 crucial critical processes, and one of them, this is continuous safety profile monitoring and benefit risk evaluation, and also business continuity plans, including the PD activities. So our main topic today is business continuity plans, and as you know, I am from Ukraine, and it's like a hot topic today. So today I'm gonna talk and tell you about my own experience of understanding that business continuity plan, it's not just a formal requirement from the regulators. It's that thing that keep companies alive. So imagine the situation when the young guy waking up early in the morning from the missile attack siren. He had used the siren before because of every year the civil defense system testing, but it never switched on 7 a.m. So he tried to get the news, and yeah, that is Russia invades Ukraine, the war has started. He sees that his wife holding newborn son in one hand, trying to catch some clothes in other hand, and he decided like to just calm down both of them and trying to go to the store and buy some food. When he go out of the yard, the things getting hotter. The helicopter flies over his head. There's a lot of military equipment. The siren continues shouting, like it's really like a movie, not a real life. But in the store was pretty quiet, so seems like no problem. And he was really calm because he knows that the nearest border to the Russia is about 1,000 kilometers, and the Russian troops has no chance and physically can't move so long distance in a few hours. So he really kept calm. And he gets some food, go to the cashier and trying to pay by his card. And it's not working, it's dead. He tried another card, trying the third one, the fourth one, but the payments were declined because the national bank system of Ukraine cannot keep up with a load. So that guy was me. I have had a newborn 2 weeks old son on my hand, and I have had my first panic attack at that moment. At that moment, after that, I realized, and I remember the Annex 11 of GMP that said that we should have a business continuity plan. And in our company, in DrugCards, we really have the business continuity plan, but I did not have a business continuity for my personal life, for my wife, for my son. Yeah, and it's strange, but I have only cards, only Visa, MasterCard, but I don't have a cash to pay for necessities. So it was really hard. For the next few hours, me and my management team implement the business continuity. It was really smooth because almost all our processes were automated, and the one problem is like to evacuate our people from the hotspots. But it also no problem. We try to move them to the western part of Ukraine, and then everything went good. We keep planning new functionality. We even keep developing new functions in our software, even in bomb shelters, in villages, and so on. So also the main reason the company feels good because we are also incorporated in Estonia. We are Estonian company, European Union company. We under the European Union law, and everything is fine. Yeah, our data bases, our data centers are in Amsterdam. Our backup servers are in New York, so records, data, fine. So no problem with that. But not all Ukrainian companies were so lucky as we. And after a week or two, I have seen a lot of messages on LinkedIn that pharmacovigilance specialists and QPPVs trying to find jobs. And things are getting more clear why. It remember me the situation when in 2016, I was working in a quality assurance group, and that was like an ordinary square-shaped office, yeah? And everybody sits on the corners. Suddenly, I have seen on my screen in 2016, screen went black, and there is like a Windows message about some error, and it was in capital letters. Please do not shut off your computer. I remember that I think so Microsoft never put the messages in capital letters, so it's like kind of strange, but let it be. Okay, I don't put on this computer. And after seconds, my screen went black. My colleague who was responsible for the audits screen went black. The next people went black, black, black. The whole factory went black. And then the half of Ukraine computers went black. It was a cyber attack called Petya virus, and that cyber attack like increased damage in Ukraine. A lot of industries were suffered from this, from postal services to Ministry of Defense, and also pharmaceutical industry. So because that virus encrypts data on local computers and try to get some money from the users to decrypt it. And as on 2016, screens went black, on 2022 February, companies that provide pharmacovigilance services went black too because of war. So we try to help Ukrainian companies. We know that our processes are fully automated. We can do the medical tissue monitoring in a very simple way. So we just for free let them use our software and make them alive and make them continue to ensure their contracts with other organizations. Because so we have like, for example, one pharmacovigilance specialist, and if she work only 20 hours a week, she can help more than 10 pharmacovigilance projects by medical tissue monitoring. Yes, it depends on how many medicines the companies have on their portfolio, what is these medicines, but it was real efficiency. And at this time, I understand that the automation may be the key benefit while you implementing the business continuity plans. So what is the business continuity? Yeah? The business continuity plan is like an ability for the company to keep working the critical processes, and it implementing to like decrease the period of time your company is not working and your crucial process is not working. So as you know, the pharmacovigilance drug safety is a continuous process, and it must work every time. All process must work every time. So to make clear, to implement efficiencies, the business continuity plan, you have to define some critical operations and functions that need to be continued, and you need to categorize them. One of those, we can categorize them in 3 categories. It's crucial and need to be maintained in the country, can be relocated or performed remotely, and can be temporarily suspended. So, and while you're activating, there is 4 phases of activating the business continuity plan. We have experience in that, yeah. So the first, it's activation. You need such system to like inform everybody in the company that you are implementing a business continuity plan. It may be some messengers, it may be like email, it may be person to person, and so on. The second one is operations. You need to do something. It's need to be in your procedures, need to be in your SOPs, and so on. So, and we call this like commanding. You need to put an orders to your staff, because like it's a 3-level of managing. Yeah, the first level is like coaching, the second level is managing, and the third level, the lowest level, is like giving an orders. So if you have a critical situation, a disaster, you need to give an orders to your staff because they need to comply with it. The third phase is returning to normal operations, and the fourth phase is like reviewing the results, trying to make something better, maybe update your business continuity plan for the next time. So if you go back to the good pharmacovigilance practice, there is 2 requirements that are connected to us. So the market authorization holders need to perform medical literature monitoring, especially local medical literature monitoring, at least once a week. In every country they perform the activity. And the second one is that there must be, it's the first one about the local literature monitoring, and the second one about the publications in local journals. But some market authorization holders says and supposed to that medical literature is not a reliable or is not a valid source of drug safety information. But as you remember, yesterday Maciej tried to explain that it's a really reliable source of information. It's there is information, a lot of information about drug safety in local medical literature. So I like this slide because if you took the acetylsalicylic acid, it shows how reporting regarding the types of source due to one substance, due to this is the same substance. For example, if you took acetylsalicylic acid, you may see that the number of reports from literature is almost 3 times higher than from spontaneous cases. And the research says that the medical literature is like a separate source. It's not duplicating the spontaneous cases, so it's really important source of information. And also, if you took the European Medical Agency Signals management team, they show us that in 2021, about 9, maybe 10, sorry, maybe 10%, all signals that coming from were coming from medical literature. So it's a lot, I think. Also, so what are we looking for in medical literature? Of course, it's ACSRs, nothing new here, but also it's a special situations. For example, mislabel use, off-use, medication error, overdose, maybe recreation medicine. You know, we are all in Amsterdam, so recreation medicine also took place. Maybe some addictions and so on. So there is a lot of type of drug safety information that you could find in medical local literature. Then we look also for signals and also for local and global competent authorities. So what is the challenges of medical literature monitoring we are facing with? The first one is managing of the local sources, because, you know, there is so hard to find like a list of local journals in such market, in such country. Yeah? Typically, there is no such list. In Ukraine, we have a national Ukraine State Expert Center that provide such recommendations with a list of medical journals that you should follow, you should read. It also have 2 editions, but to be honest, it's really poor of quality. So you need to find these journals by your own. And if we took Ukraine, Poland, Bulgaria, and so on, there is almost more than 150 journals per country. I think Maciej can agree with me. So there is really a lot of journals. So you need to manage all of this list. You need to find this and so on. The second problem is identification of safety data. The best option, if the journals will be in like PDF, you can just find the information you need and so on. But often the PDFs are broken. Often the journals are in some images, scanned PDFs. And sometimes you find journals that was in like dinosaur technology, it's SVF, like in flash files and so on, it's animations. I don't know why the libraries and other sites do this, but sometimes it's happen. And sometimes when we are talking about different libraries, can be a situation where one journal will be published in a few different websites, and some of them can be outdated. So you need to manage all of these lists. The second one is managing the local MLM process. It's also hard because you need to have a people, staff that will read all of the data. And we have a colleague that complains that when they go to the new CRO company, she was responsible for medical literature monitoring, and it took almost 75% of working time, and it's really demotivating. And the second problem, when the person is demotivated, she doesn't think about drug safety. She thinks about how to not to do a routine. And the last one is PV compliance. You need to make a screenshots. Yeah, you need to make all of these records according to data integrity and so on. So it's main problems with MLM. So the traditional approach is reading from cover to cover without automation, but I believe personally, this approach might be and should be changed. So even if we are talking about automation, the main rule of GXP, even data integrity, is that if the system reduces the quality of process, it can be used. So you don't need to implement any computerized system if it reduces the quality of the results. Because the pharmacovigilance about patients. So we need to take care about patients. If it reduces the work, but also reduces the quality of work, we do not need to implement any solution. So our main rule in our company is the quality is the best business plan. So we implement on the Z decisions, Z solutions that could improve the quality. And also I'm one of the reviewer of the ISP GAM5 recommendations about the data integrity. So we implement like all the Alcoa Plus rules when we not developing the system, but the previous level when we are designing this system. So this is why we are fully compliant in Alcoa. So how it works? We have a web crawler that works almost 60 times faster reading the medical literature than human can. It can include PDF, scan PDF, images, even zip archives, any type of source. And then it gives a notification to the company drug safety specialist, to the pharmacovigilance specialist, or to the QPPV. And then we have a workflows that can allow you to do the quality control of medical literature. So it's really fast. And what's good, we have developed a system and network of our partners in different countries. So if you are going to the new market and you don't know which journals has to be read, you just go to the DrugCard settings and you could put the checkbox, you want to read this article, this journal or not. So we have like a list of the journals in every country. At this moment, we are covering more than 15 countries. And it's really ensuring the business continuity through the whole process. And so, for example, if in Ukraine we have 100 medical journals in a country list, in a typical approach, they will issue it quarterly, once a year, once a month, sometimes once a week. So it is about from 7 to 15 journal issues, full issues, published every week. And it's very hard to manage this number of journals because one issue can contain from 100 to like 500 pages. And if we decreasing the situation by the decreasing this number of pages by automation, we could go only to 5-7 separate articles per week. So how its results looks, when the system finds new information, you will get a notification, and also it's like a web interface. You have some categories, new safety information, basic safety information, knowledge base, and so on. And you have a title of that article, you have the source name, like source of journal, day where it was found, and so on. Also, the system generates automatically reports, so it also decreases the time the PV specialist must spend on these activities. So if you imagine the future when you should not read tons of medical journals, you just can choose information that you want and read it. If you imagine the future that you will not engage it in routine, you will just think about drug safety. So we are on the same way. And I'm here to communicate with you to gain some new insights, and together as a professional, as industry leaders, to build a solution that can automate medical literature monitoring. So let's join and try. Thanks.
Thank you, Dmytro. I think literature, it's part of our daily life. Literature reviews, part of our daily life since ages, but it's good to see that there is always place for innovation, for new tools that will facilitate. And we have had the whole morning discussions around digitalization, digitization, and so on. So I think that was a nice continuation. You will look for the online questions. No question yet in the room. It just confirmed for me, it looks like the tool is oriented towards rather local literature review, but am I wrong to say that it can handle also global literature review?
Of course, yeah, we're including global health authorities like MHRA, TGA, FDA, and so on. So the system is built. It's don't mind what is the source. You just give this information like web source or not web source. Technical specialist will configure the source and it will ingest all the information. So yeah, we can cover the global literature.
So you mentioned that your system can take any kind of file or image. Does that mean that you can modify the software to look at social media?
The social media is like a different type of sources, but if you're talking about a Twitter, there is a chance to monitor the Twitter. But if you're talking about Facebook or some other social media, there is some kind of problem because imagine that a minute ago you create a new account and you post that you had an adverse reaction with a headache or paracetamol, yeah. So it will no indexed of any global searches, even Google and so on, because you just created this page, and so it's hard to get a new information from this little type of tiny pages or tiny publics or personal accounts. But in general, it could be. The difference between Twitter and Facebook, because the Twitter has an open API that we could connect to it and monitor this type of source, but Facebook, it's really hard.
Okay, thank you.
Then if I may ask, maybe I didn't catch it. What about handling different languages? Because if your tool is tailored to work with the local literature, I assume that they can handle many local languages. Is that an automated translation or it's a configuration towards a local language?
At this moment, we support more than 100 languages, so it's almost the whole world, yeah. And we are working on solutions on automatic translation. I know that in drug safety pharmacovigilance, there must be a confirmation that there is a correct translation, yeah. But if the system provides the prior translation, you could decide whether it is safety information or not. So yeah, it has automatic translation of text.
Thank you.
Thanks.
Okay, then please give another round of applause to Dmytro.
Thanks.
Thank you very much for Very nice presentation. Oh, there is one question online. Sorry. Please stay wild.
Sorry, just one last question has just come in from Jenny. Does the system allow for the tracking of the review of the articles and if ICSR's other relevant safety info are identified?
If I understand correctly, yes. If there one person, for example, you have several accounts in the system, some accounts for pharmacovigilance specialists and some for QPPVs. So the one person will choose, like on this button, the category, for example, a new safety information that include a CSR, and the second one, the QPPV will like approve this, and that all information will go to the audit trail and report. So you can track who categorize and who find the new safety information.
Then the safety information will be automatically transferred to the case processing, for example.
Yeah, we have like I don't have a screenshot, but we have adverse reactions database, so it will be automatically transformed to the IE database.
Okay, thank you. No other questions?
Jenny just said thank you.
Thanks.
Thank you. Okay, with that, thank you very much, Dmytro, again. It's the time to introduce the next.